to rapidly reverse blockade induced by vicuronium, rocuronium and pancuronium. A deep block, characterized by no train of 4 TOF twitches, but a post-tannic count PTC of 1-2 can be successful. Year-old female who is intubated and ventilated following a subarachnoid hemorrhage, 7 days previously has a serum sodium concentration of 128 mol/L and serum osmolality of 270 mosm/kg. Which of the following statements is true? A. To diagnose SIAD, urine osmolality must be greater than serum osmolality. A2. An 82-year-old female undergoes total hip replacement under general anesthesia. She receives an intravenous induction and volatile maintenance, with propofol and isoflurane, respectively. In recovery she becomes extremely agitated and appears to be hallucinating, in association with a sinus tachycardia at a rate of 110 bpm. Which of the following drugs, if administered during the procedure, is most likely to be responsible for her current clinical state? A. Atropine 0.6 mg. B. Morphine 5 mg. C. The commonest source of airborne microparticles in the operating theater is A. Staff wearing foot traffic into and out of theater. C. Staff. The introduction of the agent Sugammadex has drastically changed the management of aminosteroid-induced neuromuscular blockade. Which of the following facts concerning its use is most accurate? A. It can be used to rapidly reverse blockade induced by vicuronium, rocuronium. The activity of the oral contraceptive pill may be reduced by Sugammadex. E. The speed of reversal. Anesthesia provided for electroconvulsive therapy (ECT) is frequently provided in remote locations, and the conduct of anesthesia may influence the efficacy of treatment. Which of the following statements is most correct? A. Propofol should be avoided as it prevents the induction of inadequate seizure. E. Sudzamathonium is used primarily to prevent musculoskeletal injury. A6. The provision of general anesthesia in the MRI scanner has many equipment considerations. Which of the following statements is most accurate? A. Equipment specified Mr. Equipment has been shown to demonstrate no known hazards in a specified Mr. A 62-year-old male admitted to the ICU following emergency repair of ruptured abdominal aortic aneurysm repair has developed multisystem organ failure and thrombocytopenia. He is prescribed continuous hemofiltration with an ultrafiltrate of 35 ml/kg/h. The lifespan of the filter is short due to problems attributed to clot formation despite using unfractionated heparin. You have just been informed that the patient has heparin-induced thrombotic thrombocytopenia. Discuss explanalia forte __, TAT-E acute. What first-line strategy would you employ to improve the lifespan of the filter? D. Administer the replacement fluid pre-filter. E. A8. Analgesia for upper limb procedures can be provided by means of a brachial plexus block. For operations on the proximal part of the upper limb, a relatively high approach is required and an interscalene block is used. Which of the following is true? B. An interscalene block commonly misses the roots of the ulnar nerve. C. E. A9. A 27-year-old man on the ICU underwent decompressive craniectomy 7 days following an acute subdural hematoma. He remains intubated and ventilated and has become agitated with a heart rate of 120 bpm and a BP of 80/40ths mmHg. His urine output is 200 ml/h. Further serum and urinalysis reveals the following results: serum osmolality 300 mosm/L, Na plus 120 mol/L, urine osmolality 300 mosm/L, Na plus 40 mec/L. Which of the following would be the most appropriate next step in your management? A. Fluid restriction. B. Fluid resuscitation with 0.9% NaCl. A10. A patient with a known history of migraine presents to the emergency department with a severe migraine, which has failed to respond to his usual treatment of paracetamol and ibuprofen. Which of the following is most likely to help him with his acute pain? A. Sumatriptan. B. Amitriptan. C. Pro. E. Pazotifin. At IMEX-X-ray study IA11, a 19-year-old female presents to the emergency department stating that she took an overdose of 50 times 500 mg paracetamol tablets 30 minutes ago. It is decided to attempt gastrointestinal decontamination. Which of the following regimens would be the most appropriate in order to reduce paracetamol absorption in this patient? A. B. Gastric lavage. E. Activated charcoal 50 grams administered by mouth. A12. Activated charcoal 50 grams administered by mouth. A12. A 26-year-old male weighing 70 kilograms has presented to the emergency department following a house fire. He is estimated to have full-thickness burns to the chest, abdomen, back and right arm. He has partial thickness burns to the right leg. Using the Parkland formula, you estimate that the amount of replacement fluid the patient requires in the first 8 hours is A. 8,820 ml. Fetal heart, and can demonstrate an understanding of hypoplastic left heart syndrome (HLHS) can aid understanding of the fetal heart, and can demonstrate how ventilatory strategies can be used to manipulate physiology. Which statement is correct regarding HLHS? Following Norwood procedure, a sensible first option would be to decrease the FiO2d. Rising lactate and hypotension. Fibromyalgia is part of a spectrum of chronic pain disorders. Progress has been made in the treatment of chronic pain, but reliable long-term treatment is still problematic. In the treatment of fibromyalgia, which of the following is most correct? A. SRIS improve mood but have little effect on pain. C. SRIS improve mood but have little effect on pain. C. SRIS improve mood but have little effect on pain. C. Pump (EAB) increases the oxygen delivery to the myocardium and decreases the myocardial oxygen demand, thereby improving its function, especially in heart failure. Which of the following physiological effects are not seen with a well-functioning EAB? Renal blood flow. E. Down arrow hemoglobin levels by up to 5%. A16, a 12-year-old boy with moderate learning difficulties requires multiple dental extractions due to poor dentition and previous dental abscesses. He has multiple previous admissions to hospital. He is crying, appears terrified and is refusing to have topical local anesthetic cream applied or to cooperate. Offer oral midazolam, starting at 0.1 mg kilograms, with maximum dose of 15 mg. Repeat the dose if the first does not work. A17, pleural effusions are caused by a number of pathologies. Which of the following? Liver cirrhosis can cause an transudative pleural effusion. D. A transudative pleural effusion is characterized. A18, a 75-year-old patient with type 2 diabetes had a below-knee amputation under a combined spinal epidural block. 3 months later he is still complaining of phantom limb pain despite simple analgesics. Which treatment has the best evidence to support its use in this scenario? Gabapentin. A19, a 75-year-old female who is being treated. Gabapentin. A19. Gabapentin. A9. Gabapentin. A19, a 75-year-old female who is being treated with broad-spectrum antibiotics for ventilator-associated pneumonia develops abdominal distension and diarrhea. Her white cell count is 20 times 109 and her temperature is 38.9 degrees Celsius. You suspect that she has Clostridium difficile infection. The most appropriate first-line treatment would be A. Enteral vancomycin 125 mg QDSB. Enteral metronidazole 400 mg TDSC. Intravenous metronidazole. Enteral vancomycin 120. 75-year-old female who is being treated with broad-spectrum antibiotics for ventilator-associated pneumonia develops abdominal distension and diarrhea. Her white cell count is 20 times 109 and her temperature is 38.9 degrees Celsius. You suspect that she has Clostridium difficile infection. The most appropriate first-line treatment would be A. Enteral vancomycin. After the 2007 CEMIC report, the Royal College of Obstetricians and Gynecologists published guidance on thromboprophylaxis during pregnancy. In which of the following clinical scenarios should thromboprophylaxis be continued for at least 7 days postnatally? Caesarean section in labor. A21, a 10-year-old boy with appendicitis has been listed for an urgent appendicectomy. He has some mild learning disabilities and is on sodium valproate for his epilepsy. His seizures are generally well controlled, but his mum reports that his last grand mal seizure was 2 days ago. In anesthetizing the child with epilepsy, which of the following is true? A. Regional blockade or local anesthetic. C. Fentanyl is a preferable opioid to alpha-fentanyl. Fentanyl is a preferable opioid to alpha-fentanyl. D. Fentanyl is a preferable opioid to alpha-fentanyl. D. History of worsening. Man is referred to your pain. A 60-year-old man is referred to your pain management clinic via his GP. He gives a 6-month history of worsening lumbar back pain that is not eased with rest or simple analgesics. He suffers from ulcerative colitis, which is well controlled with mesalazine. On examination, he has a good range of lumbar spine movement, normal power and reflexes, but reduced sensation in the L5 dermatome on the right. What would be the next step in his management? A. Arrange a lumbar epidural. B. Prescribe a strong opioid and review in 3 months. C. Refer for a neurological opinion. D. Year-old man is referred to your pain management clinic via his GP. He gives a 6-month history of worsening lumbar back pain that is not eased with rest or simple analgesics. He suffers from ulcerative colitis, which is well controlled with mesalazine. On examination, he has a good range of lumbar spine movement, normal power and reflexes, but reduced sensation in the L5 dermatome on the right. What would be the next step in his management? Request an MRI scan. A23, pharmacokinetics of anesthetic drugs in the morbidly obese patient changes significantly. Which of the following statements with regard to anesthetic drug dosing in the morbidly obese is true? A. Theo. B. E. Propofol used as infusion for total intravenous anesthesia should be based upon total body weight. A24, hemorrhage is one of the top 5 most common causes of maternal death according to the 2010 CMS report. Which of the following is correct regarding blood transfusion in the pregnant state? A. Red cell only. C. Massive blood loss may be defined as the loss of one blood volume within a 24-hour period. D. Massive blood loss may be defined as the loss of one blood volume within a 24-hour period. D. Massive blood loss may be defined as the loss of one blood volume within a 24-hour period. D. 8. Cardiac resynchronization therapy (CRT) has a role to play in the management of patients. It is indicated for A. Moderate aortic stenosis. B. Paroxysmal atrial fibrillation. C. Recurrent ventricular tachycardia. D. Restrictive cardiomyopathy. E. LBBB foot O, TBB, A26, postoperative cognitive dysfunction, POCT, is increasingly recognized as a cause of postoperative morbidity. With regard to its predisposing factors, which of the following statements is true? A. Early POCT is more likely in patients with lower levels of education. C. When managing these patients, diabetes is the most common endocrine disorder affecting UK patients. It is a complex disorder and can have multi-systemic effects, many of which are relevant to anesthetic practice. When managing these patients, which is the greatest consideration? Read the duration. D. Pain in diabetic patients may increase insulin requirements by as much as 20%. E. A bronchopleural fistula is an abnormal communication or a passage between the bronchial tree and the pleural space, causing a persistent leak. If these patients are mechanically ventilated, the management strategy should be A. B. Reduced inspiratory pressures. C. A29, you are asked to review a 68-year-old woman with shortness of breath and hypotension on the surgical HDU, 24 hours after an anterior resection for bowel cancer. Which of the following statements regarding venous thromboembolism (VTE) in this patient is most true? Rate B. Around 25. C. Caval filters may increase rates of VTE. 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 TD. A high D-dimer imaging is A30, which is the most important consideration that should be observed when performing laser airway surgery with an endotracheal tube ET in place. A. Inspired oxygen concentration should be kept as low as possible. Old male returns from theater after quadruple bypass surgery. He has a pulmonary artery catheter in situ and develops a sustained ventricular tachycardia as you attempt to float the catheter. The most appropriate step in management would be B. Electrical cardiology. C. Removal of the catheter tip from the right ventricle. A 38-year-old alcoholic male is admitted with severe upper abdominal pain of 24 hours duration. Infected peripancreatic necrosis is confirmed on a computed tomography scan. The most appropriate initial management is A. Conservative treatment with broad-spectrum antibacterial. Conservative treatment with broad-spectrum antibacterial. Conservative treatment with broad-spectrum antibacterials. E. Conservative. E. Minimally invasive. B3, a 55-year-old female with previous mitral valve replacement, mechanical valve, for rheumatic heart disease presents with a 3-week history of increasing lethargy and intermittent febrile episodes. Blood cultures have grown Staphylococcus aureus and she has been commenced on flucloxacillin. A transthoracic echocardiogram performed on admission demonstrated a normal-looking mitral valve prosthesis. Following a period of initial improvement, she becomes more unwell, developing increasing dyspnea, tachycardia, heart rate 130 and irregular, and embolic phenomena such as peripheral vasculitic lesions. What is the next best step? B. E. Arrange for a transoesphageal echocardiogram. Arrange for a transoesphageal echocardiogram. Arrange for a transoesphageal echocardiogram. B4, a 78-year-old female has undergone an aortic valve replacement 6 hours previously. She is hypotensive with increasing vasopressor requirements and her central venous pressures are elevated. She develops a severe bradycardia and you are unable to feel a carotid pulse. There is no response to 3 mg of atropine administered via a central line or to epicardial pacing. The next most appropriate step would be emergency resternotomy. Emergency resternotomy. Administration of fluid challenge. D. Emergency resternotomy. E. Emergency resternotomy. E. Emergency resternotomy. E. To the emergency department, to see a 45-year-old male who has been found in his garage with his car engine running. His face is a cherry red color in appearance, he has a GCS of 12 and the pulse oximeter reads 100% whilst breathing room air. Your initial priority would be to check blood glucose. Deliver high flow 15 liters minute oxygen via a non-breathe mask. D. Deliver high flow 15 liters minute oxygen via a non-breathe mask. Deliver high flow 15 liters minute oxygen via a non-breathe mask. D. Are called to the emergency department to see a 30-year-old male who has a history of intravenous drug use. He has been found semi-conscious on the floor at home. His friend states that he is unsure how long he had been lying on the floor. His creatinine kinase result is 5,000 units L. The arterial blood gas shows pH 7.28, PO2 13.5 Pa, CO2 3.3 Pa and K plus 5.5 mol L. The initial most appropriate management step would be to increase fluid administration to maintain a urine output of greater than 100 ml/h. Increase fluid administration to maintain a urine output of greater than 100 ml/h. Increase fluid administration to maintain a urine output of greater than 100 ml/h. Previously well 9-year-old boy presents to the emergency department with diabetic ketoacidosis. His initial pH was 7.1 with a PCO2 less than 2 Pa and lactate 1. He is initially treated with insulin and fluid replacement. He receives 40 ml/kg of 0.9% saline over 3 hours. You are called to review because he has become increasingly drowsy. What is the most likely cause of his deterioration? B. Cerebral edema. C. Cerebral edema. C. Cerebral edema. C. Cerebral edema. C. While on call for the labor ward, you attend a cardiac arrest of a 33-year-old woman. 30 minutes earlier, you inserted an epidural for labor analgesia. On arrival, CPR is in progress. It appears that the epidural giving set has been mistakenly connected to the patient's peripheral cannula. Which of the following would be considered correct in this patient's management? B. An infusion at D. 20% lipid emulsion, given as an initial bolus of 1.5 ml/kg over 1 minute, followed by an infusion at 15 ml/kg per hour. D. 20% lipid emulsion, given as an initial bolus of 1.5 ml/kg over 1 minute, followed by an infusion at 15 ml/kg per hour. An infusion at D. 20% lipid emulsion, given as an initial bolus of 1.5 ml/kg over 1 minute, followed by an infusion at 15 ml/kg per hour. D. 20% lipid emulsion, given as an initial bolus of 1.5 ml/kg over 1 minute, followed by an infusion at 15 ml. D. 20% lipid emulsion, given as an initial bolus of 1.5 ml/kg over 1 minute, followed by an infusion at 15 ml/kg per hour. 20% lip. All anesthetic drugs are associated with cardiovascular changes. Optimizing patient outcomes requires knowledge of the effects of particular agents, how to offset them and when they might be advantageous. Regarding anesthetic agents, which statement is most correct? E. All anesthetic vapors are cardioprotective. E. C. All D. All anesthetic vapors are cardioprotective. E. All anesthetic vapors are cardioprotective. E. All anesthetic vapors are cardioprotective. E. Are assessing a 39-year-old male in your chronic pain management clinic. He gives you a 6-month history of pain in his lower back. There is no history of trauma and he is otherwise well. Your examination is unremarkable. He takes regular paracetamol and ibuprofen, which slightly ease the pain. After discussing analgesic options, what would be the next step in your management of this patient? A. Offer a course of physical therapy. B. With regard to intraoperative cell salvage, X, which of the following statements is true? Nice have. C. It is not safe to aspirate iodine into the X system. A. Which of the following? Jehovah's. Acromegaly is an important anesthetic consideration. It is. Which of the following statements regarding acromegaly is most accurate? Larger than normal. Supplemental thyroxine may be required because TSH release is reduced. Supplemental thyroxine may be required because TSH release is reduced. Supplemental thyroxine may be required because TSH release is reduced. Supplemental thyroxine may be required because TSH release is Supplemental thyroxine may be required because TSH release is reduced. Cardioplegia solutions are primarily used to arrest myocardial contraction and facilitate cardiac surgery. They have a number of other important properties, and knowledge of the type of cardioplegia to be used along with the delivery method can influence anesthetic delivery. Which of the following is the most accurate statement? Cold cardioplegia reduces Anterograde cardioplegia delivery produces more rapid cardiac arrest than retrograde. D. Anterograde cardioplegia delivery produces more rapid cardiac arrest than retrograde. D. Anterograde cardioplegia delivery produces more rapid cardiac arrest than retrograde. D. Anterograde cardioplegia delivery produces more rapid cardiac arrest than retrograde. Anterograde cardioplegia delivery produces more rapid cardiac arrest than retrograde. D. Cold cardioplegia. During an emergency repair of an abdominal aortic aneurysm, your strategy to reduce the risk of postoperative renal impairment involves A. Maintaining an adequate extracellular fluid volume and perfusion. During an emergency repair of an abdominal aortic aneurysm, your strategy to reduce the risk of postoperative renal impairment involves A. Maintaining an adequate extracellular fluid volume and perfusion pressure. Risk of postoperative renal impairment involves A. Maintaining an adequate extracellular fluid volume and perfusion pressure. Cardioplegia. B14. During an emergency repair of an abdominal aortic aneurysm, your strategy to reduce the risk of postoperative renal impairment involves A. Maintaining an adequate extracellular fluid volume and perfusion pressure. You are asked to see a lady in the recovery area. She has a history of hyperthyroidism and has just undergone a knee arthroscopy under general anesthesia. She had to undergo a rapid sequence induction for gastroesophageal reflux disease. She is tachycardic, hypertensive, has a temperature of 40 degrees Celsius and is agitated. Her muscle tone is flaccid and she is also vomiting. The mainstay of your management plan is A. Propranolol in 1 mg increments, hydrocortisone and propylthiouracil, as this may be a thyroid storm. D. Propranolol in 1 mg increments, hydrocortisone and propylthiouracil, as this may be a thyroid storm. D. A thyroid storm. Propranolol in 1 mg increments, hydrocortisone and propylthiouracil, as this may be a thyroid storm. D. You are asked to review a child who has undergone a tonsillectomy 2 hours ago. Which of the following statements is most accurate, with regards to a post-tonsillectomy bleed? Gas induction with sevoflurane is reasonable despite the presence of blood in the stomach. E. Rapid sequence induction is mandatory. Are asked to assess a patient in the obstetric clinic who has von Willebrand's disease. She is keen to have an epidural for labor if required. There are several types of this disease. Which type commonly gets better during pregnancy? The anhepatic phase of liver transplantation is associated with many physiological derangements. Which of the following best describes these derangements and the subsequent management? A. Hypocalcemia with myocardial depression may develop secondary to the citrate load from blood products and the inability to metabolize it. This can be treated with calcium administration. Hypocalcemia with myocardial depression may develop secondary to the citrate load from blood products and the inability to metabolize it. This can be treated with calcium administration. Load from Hypocalcemia with myocardial depression may develop secondary to the citrate load from blood products and the inability to metabolize it. This can be treated with calcium administration. History of lower back pain. A 23-year-old, female, ex-intravenous drug user attends the pain clinic with a 3-month history of lower back pain, which does not radiate down the lower limbs. There is no history of trauma, nor are there any features of Kawada-Akina syndrome. What should be done next? A. Refer for pain. D. Arrange an MRI scan of the lumbar spine. An unwell 17-year-old girl with a Fontan circulation is listed for an appendicectomy for suspected perforated appendicitis. Which of the following is contraindicated in the management of this patient? A. Giving 10 milliliters. B. Maintaining a heart rate of less than 60 bpm. Maintaining a heart rate of less than 60 bpm. Maintaining a heart rate of less than 60 bpm. Maintaining a heart rate of less than 60 bpm. An unwell 17-year-old girl with a Fontan circulation is listed for an appendicectomy for suspected perforated appendicitis. Which of the following is contraindicated in the management of this patient? Giving 10. B. Maintaining a heart rate of less than 60 bpm. The diagnostic criteria of acute lung injury (ALI) and acute respiratory distress syndrome (ARDS) differ when describing A. The rate of onset. B. The chest X-ray. The PAO2/V. The pulmonary artery. The PAO2/VO2 ratio E. The PAO2/VO2 ratio E. The PAO2/VO2 ratio E. Delirium is a frequent complication of intensive care that prolongs ICU and hospital stay. It can be caused by, or worsened by, drugs, pathology or situational factors. Which statement is most accurate? A. B. In patients of delirium. C. Patients with delirium related to acute illness are at high risk of developing a chronic cognitive deficit. Patients with delirium related to acute illness are at high risk of developing a chronic cognitive deficit. D. Patients with delirium related to acute illness are at high risk of developing a chronic cognitive deficit. D. Patients with delirium related to acute illness are at high risk of developing a chronic. Patients with delirium related to acute illness are at high risk of developing a chronic cognitive. Patients with delirium related to acute illness are at high risk of developing a chronic cognitive deficit. D. Chronic cognitive deficit. Chronic cognitive deficit of delirium. C. Patients with delirium related to acute illness are at high risk of developing a chronic cognitive deficit. D. A. Occur over different. B23. Intrathecal opioids have proven extremely useful in both prolonging the duration of spinal anesthesia and in reducing total doses of local anesthetics. Which of the following is most accurate? A. Intrathecal morphine is associated with respiratory depression after discharge from recovery. Intrathecal morphine is associated with respiratory depression after discharge from recovery. B. But is also the nurse says the patient is. A 9-year-old patient is fitting. The nurse says the patient is recovering from a chest infection, but is also known to have epilepsy. The drug chart at the end of the bed shows that the patient is on phenytoin and levetiracetam. The nurse applies high-flow oxygen. There is no IV access in situ. Which of the following is the most appropriate course of action, assuming seizure activity continues? A. Spend up. B. Spend up to 5 minutes gaining IV access. Give IV lorazepam 0.1 mg kg. Give IV phenobarbital 20 mg kg. C. After falling off his. Give IV phenytoin 20 mg kg. B25. A 19-year-old male patient with known sickle cell disease presents for urgent humeral nailing after falling off his bicycle. Full blood count reveals an HB of 6.9 grams per deciliter. The orthopedic team decides to resuscitate him by transfusing with 2 units of PAT red blood cells prior to surgery. The patient becomes tachycardic and complains of difficulty breathing, but denies chest pain. The most likely cause is acute pulmonary edema following transfusion-associated circulatory overload. Acute pulmonary edema following transfusion-associated circulatory overload. Acute pulmonary edema following transfusion-associated circulatory overload. You are managing a 30-year-old male admitted to ICU 2 hours ago due to polytrauma following a road traffic collision. He had a prolonged extraction time and his CK is 20,000 UL. His urine output has been less than 30 milliliters H for the last 2 hours. Your first action would be B. Resuscitation with 0.9% saline and check his plasma potassium. Resuscitation with 0.9% saline and check his plasma potassium C. Resuscitation with 0.9% saline and check his plasma potassium C. A non-diabetic patient attends pre-assessment clinic after being listed for spinal surgery. He informs the nurse that he has been diagnosed with neuropathic pain in his left leg for which he currently takes cocodamol, 2 tablets 4 times a day. His symptoms are not controlled and you are phoned for advice. Which of the following drugs is the most appropriate first-line treatment? A. Tramadol. B. Amitriptyline. Amitriptyline C. Amitriptyline. Tramadol B. Lidocaine patches E. Duloxetine B28, a previously fit and well 50-year-old male underwent a decompressive craniectomy for an acute subdural hematoma following a traumatic head injury 24 hours ago. He is now on the neurosurgical intensive care unit and remains intubated and ventilated. You have been asked to review his urine output, which is recorded as 800 milliliters over the last 2 hours, despite appropriate intravenous fluid administration. You suspect neurogenic diabetes insipidus. Which of the following features would support your diagnosis? Serum osmolality less than 200. Urine osmolality less than 350 mol/kg. Serum Na plus less. C. Urine osmolality less than 350 mol/kg. Urine osmolality less than 350 mol/kg. D. Urine osmolality less than 350 mol/kg. Transversus abdominis plane (TAP) blocks have recently gained popularity for the provision of analgesia after a range of surgical procedures. A 70 kg patient is listed for a total abdominal hysterectomy, for whom a TAP block is planned. Which of the following is most accurate? A. D. The triangle of Petty is bounded inferiorly by the iliac crest. 24-year-old known as Mac presents to the emergency department with an acute asthma attack. She has received 2 boluses of 5 mg of salbutamol via a nebulizer, nebulized ipratropium bromide and hydrocortisone. Despite these measures, she has failed to improve. You are called to assist in her management. Your examination reveals a respiratory rate of 35 min-1, heart rate of 100 min-1, inability to complete one sentence and diffuse wheeze. Which of the following is the most appropriate management? A. Continuous nebulized salbutamol. B. Sedation and anesthesia are often required to enable dental treatment to be performed. Concerning the following statements regarding dental procedures, which is most accurate? A. Dental practitioners. D. Proper. Intravenous conscious sedation may be administered by appropriately trained dental practitioners. D. Intravenous conscious sedation may be administered by appropriately trained dental practitioners. Intravenous conscious sedation may be administered by appropriately trained dental practitioners. The major factor responsible for the spread of particles, including microorganisms, by anesthetists in the operating theater is A. D. Entering and leaving the operating theater. D. 35-year-old female requires a vaginal hysterectomy for menorrhagia. The patient plays competitive tennis and has a body mass index of 38 kg². The expected duration of surgery is 70 minutes. Appropriate perioperative thromboprophylaxis for this patient would be graduated compression stockings and A. B. Published by Cambridge University Press. University Press. C. Enoxaparin 0.5 mg/kg daily commenced within 6 hours of surgery. D. Enoxaparin 0.5 mg/kg daily commenced within 6 hours of surgery. D. Enoxaparin 0.5 mg/kg daily commenced within 6 hours of surgery. D. You have been asked to anesthetize a 72-year-old man for an emergency MRI scan of the lumbar spine to rule out spinal cord compression. Which of the following is the most valid consideration? A. The use of 100% inspired oxygen should be reported to the radiologist as it may cause degradation of the images. B. The use of 100% inspired oxygen should be reported to the radiologist as it may cause degradation of the images. B. Had become profoundly. C5, an 80-year-old woman is referred to the ICU. She had developed acute renal failure and had become profoundly hypotensive with a mean arterial pressure of 40 mmHg. She has been treated for a urinary tract infection. Blood cultures are positive for gram-positive bacteria. The most likely organism from the following list given the history is A. Staphylococcus saprophyticus. B. C. Regional anesthesia can be used to avoid the risks of general anesthesia, but is not without risks of its own. Which of the following is true? A. Bupivacaine has greater alpha-1 receptor activity than other local anesthetics. B. Lipid C7, Guillain-Barré syndrome (GBS) is an acute inflammatory polyneuropathy first described in the latter half of the 19th century. Regarding GBS, around 30% of GBS patients require respiratory support. 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 Problem C8, a 32-year-old man has undergone a recent traumatic amputation of his left forearm. Shortly before his discharge from hospital, he reports painful, unpleasant sensations in the distribution of the amputated limb. In particular, he is troubled by the sensation of involuntary spasms. Which of the following actions would you undertake first? D. Arrange mirror box therapy. Arrange mirror box therapy. E. Arrange mirror box therapy. E. Arrange mirror box therapy. E. Road traffic collision. A 70 kg man is admitted to neurocritical care with a diffuse axonal head injury following a road traffic collision. He is intubated and ventilated. He is being enterally fed via an esogastric tube. Which of the following statements most accurately describes his daily nutritional requirements? Water. B. Water 2,500 milliliters, glucose 140 grams, protein 70 grams, phosphate 30 mol. C. Water 2,500 milliliters, glucose 140 grams, protein 70 grams, phosphate 30 mol. C. Water 2,500 milliliters, glucose 140 grams, protein 70 grams, phosphate 30 mol. C. Water 1,200 milliliters. C10, a surgeon wants to infiltrate an open appendicectomy wound with some local anesthetic. The patient, a 6-year-old, 18 kg child, has had no other local anesthetic. What is the safe maximum dose of bupivacaine for this child? C. B. 7 milliliters of 0.5% bupivacaine. B. 7 milliliters of 0.5% bupivacaine. B. 7 milliliters of 0.5% bupivacaine. A. 3 milliliters. B. 7 milliliters of 0.5% bupivacaine. The anesthesia. During his preoperative, a 78-year-old man presents for a hernia repair. During his preoperative assessment, he tells the anesthesiologist he has episodic stabbing pain in his right foot precipitated by pressure. There are no sensory, motor or excretory deficits. He requests anesthetic advice on therapy. He has been taking paracetamol to little effect. What would be the most appropriate initial therapy while awaiting assessment at the pain clinic? B. Amitriptyline. D. Gabapentin. Gabapentin E. Gabapentin E. Gabapentin E. Gabapentin E. A 26-year-old gentleman is admitted to the emergency department with a closed traumatic brain injury following a road traffic collision. On application of a painful central stimulus, his eyes remain closed, he extends his left arm, and he makes incomprehensible sounds. Computed tomography, Connecticut, of the head reveals a large left-sided frontoparietal contusion with obvious midline shift. Which of the following would be the most appropriate initial interventions, after intubation and ventilation? Aim for a PACO2 of 4.5 kV, insertion of an intracranial pressure monitor and maintenance of a cerebral perfusion pressure of 60 mmHg, and maintenance. Aim for a PACO2 of 4.5 kV, insertion of an intracranial pressure monitor and maintenance of a cerebral perfusion pressure of 60 mmHg, and maintenance of a Aim for a PACO2 of 4.5 kV, insertion of an intracranial pressure monitor and maintenance of a cerebral perfusion pressure of 60 mmHg, and maintenance. Aim for a PACO2 of 4.5 kV, insertion of an intracranial pressure monitor and maintenance of a cerebral perfusion pressure of 60 mmHg, and administration of C13, a hypotensive 20-year-old man in intensive care was diagnosed to have acute renal dysfunction secondary to rhabdomyolysis after being involved in a road traffic accident. He was initially treated with aggressive fluid therapy and diuretics. Which is the most appropriate drug to be started in order to maintain adequate renal perfusion? Dopamine C. Adrenaline D. Noradrenaline. Adrenaline D. Noradrenaline E. Mannitol C14, a previously fit and well 3-year-old girl is brought into hospital by her parents with a 1-day history of being unwell, pyrexial and suffering right iliac fossa pain. She is listed by the surgeons for an appendicectomy. During the operation, she is found to have an inflamed appendix and localized peritonitis. At the end of the procedure, the surgeon infiltrates local anesthetic around the wound edges. The most appropriate postoperative pain relief would be A. Regular paracetamol, ibuprofen and nurse-controlled morphine analgesia. A 35-year-old woman with gallstone pancreatitis is ventilated on ICU. Her chest X-ray shows bilateral infiltrates and her arterial blood gas shows a PaO2 7 on a FiO2 1.0. You diagnose her with acute respiratory distress syndrome (ARDS). Which of the following interventions has been shown to reduce mortality in ARDS? C. Ventilation with 6 ml kilograms tidal volumes. D. D. Prone positioning. E. Intravenous furosemide infusion. C16, an extremely anxious 27-year-old female is listed for an urgent laparoscopic cholecystectomy. She is currently on methadone, having abused opioids in the past. Problems with pain control following her last operation are documented. Which preoperative intervention is most likely to reduce postoperative pain problems this time? A. D. 600 mg oral gabapentin. E. The incidence and prevalence of liver disease is increasing worldwide. What is the most common cause of acute hepatic failure in the UK? Acetaminophen. C18, you are asked to assess a patient in the obstetric clinic who has von Willebrand's disease. She is keen to have an epidural for labor if required. There are several types of this disease. Which type of von Willebrand's disease commonly worsens during pregnancy? C. Type 2BD. During the first few days of life, which of the following is the least likely to result in a transitional circulation? Congenital. B. Necrotizing enterocolitis. Necrotizing enterocolitis. C. Morphine per day. Which of the following? 58-year-old woman with a 15-year history of rheumatoid arthritis is taking 160 mg of oral morphine per day. Which of the following opioid patches would give her dose equivalent? E. Fentanyl 50 mcg/72 hours. E. Fentanyl 50 mcg/72 hours. E. Fentanyl 50 mcg/72 hours. E. Whilst on your preoperative visit, a patient informs you they are taking St. John's wort (SJW) as well as their normal medications. Which of the following statements is false? SJW. B. SJW can cause an accumulation of drugs such as warfarin. C. With hypertension, a 28-year-old woman of 32 weeks gestation is admitted to the labor ward from triage with hypertension, headache and epigastric pain. She is not in labor. Her vital signs are blood pressure 170/109, heart rate 100 bpm, 3+ proteinuria on dipstick. She has 2 beats of ankle clonus. The fetal heart rate is reassuring. She has not received any medication. What would you do next? A. Administer labetalol 100 mg orally. B. Or anesthetizing a 4-year-old child for unilateral squint correction. The child is breathing spontaneously on sevoflurane. Her heart rate drops to 40 bpm. Which of the following is correct? She is at increased risk of postoperative nausea and vomiting. You have anesthetized a 64-year-old male for a left upper lobectomy for squamous cell carcinoma. You are currently ventilating both lungs and now want to test the tube position and proceed to deflate the left lung. The first step you would take is, A. Open the tracheal lumen and clamp the fresh gas flow to it. Left tibia. A 42-year-old motorcyclist is scheduled for a revision of a tibial plate to his lower left tibia as a result of misalignment. He requests a general anesthetic and wants to be pain-free on awakening. The surgeons are keen for a regional block to allow him to mobilize early. The best single block you could offer would be lumbar epidural. C. 3 in posterior sciatic block. C26, you have anesthetized a 75-year-old patient for a below-knee amputation. The patient is diabetic with chronic renal failure on dialysis. There is significant blood loss intraoperatively requiring transfusion, and the surgeons are complaining he is very oozy. Coagulation studies show platelets, PT, apt and inner are normal, but bleeding time is prolonged. The most appropriate management would be to A. Send the patient for immediate dialysis. B. Give cryoprecipitate. A 35-year-old male with cystic fibrosis has had a bilateral sequential lung transplant and on day 1 post-op has a falling cardiac output (CO) as measured by thermodilution technique using pulmonary artery catheter (PAC) measurements. Other findings include temperature 37.8 degrees Celsius, heart rate 110 bpm, paced rhythm (DDD mode), central venous pressure 23 cmH2, pulmonary artery pressure (PAP) 34/20 mmHg. He is on nitric oxide, isopranolone and noradrenaline. The most likely reason for the fall in CO is A. Right ventricular failure. E. Airways disease for an about to anesthetize a 60-year-old gentleman with moderate chronic obstructive airways disease for an elective laparotomy for a sigmoid tumor. You wish to site an epidural as part of your strategy for postoperative analgesia. The patient received a therapeutic dose of low molecular weight heparin 12 hours ago for a recent deep vein thrombosis. What is the most appropriate step? Postpone the case until at least another 12 hours have passed to site the epidural. E. Check the apt ratio. 17-year-old, 65 kilograms male with Duchenne's muscular dystrophy requires a general anesthetic for tonsillectomy. He is wheelchair-bound due to muscle weakness. His cough is good. His airway examination is unremarkable. He last ate 8 hours ago, and had clear fluids 4 hours ago. Which is the most appropriate induction technique? A. Rapid sequence. Propofol plus. To use propofol tiva and attempt intubation without muscle relaxants. E. Propofol plus fentanyl induction. Patient with obstructive sleep apnea presents to your preoperative assessment clinic and you notice a polysomnography report in their notes. Which of the following parameters is not routinely recorded during polysomnography? A. Year-old man with severe claustrophobia requires a general anesthetic for an MRI scan of his entire spine. Regarding monitoring in the MRI scanner, which of the following would be the most appropriate combination of patient monitors in addition to a fiber optic pulse oximeter? 4 ECG electrodes placed less than 20 cm apart, a nib cuff.